Good afternoon, everyone. My name is Jillian Kelton, and I am the Director of Partnerships for Daybreak Health. I recently joined Daybreak after a 20-year career in the Boston Public Schools, most recently as their Chief of Student Support. I'd like to thank all of you for joining us today to discuss this extremely important topic, which is directly related to Daybreak's mission of providing equitable and accessible school-based mental health services for all students in a way that is both culturally and linguistically affirming of their identities. At Daybreak, we partner with districts across the country to provide school-based mental health programs that are designed to give every student equitable access to high quality and culturally competent care that meets their unique needs at no cost to families. I could not be more excited for this much needed conversation with our panelists today about breaking the stigma around mental health in Black communities so that Black youth can get the mental health support they need. We know that Black youth are at a higher risk of experiencing mental health challenges due to discrimination, trauma, poverty, and so many other things. The suicide rate among 13 to 30-year-olds is growing fastest in the Black community, rising over 50% between 2010 and 2019. For me, as a person of color who has spent my entire professional career working in a district that serves majority of minority students, this topic is one of the most important to me. In Boston, I worked incredibly hard to create strong and meaningful connections with students, families, and community members to create a foundation of trust that would allow for more open conversations around access to mental health support for our students. I know that this is a very important topic for all of you as well, as we have over 500 people from districts across the country that registered for this webinar. So I want to introduce you to our panelists. Our first panelist is Dr. Wenimo Okoya, who is the founder of the Healing Schools Project. Dr. Okoya brings equity-focused mental health program to K-12 schools. In her prior role at the Ed.D Foundation, she worked with schools, organizations, and individuals to enhance their adoption of anti-racist, trauma-sensitive cultures. Using her experience in K-12 schools, Dr. Okoya founded the Healing Schools Project, which brings thoughtfully designed programs to support teacher mental health and well-being in an effort to retain educators, specifically educators of color. We also have Granville Freeman. Mr. Freeman has over a decade of experience working with students as a school-based mental health professional. Today, Granville works for the Metro RESA in the Atlanta metro area as a coach, helping schools to become community schools. He facilitates and develops mental health training and support for schools in Metro Atlanta. Mr. Freeman also has his own private practice where he provides group and individual counseling and trainings and workshops for children, adolescents, adults, and families. Before we get started, I want to share that we'll be recording this, and we'll share the recording out with all of you in the next day or so. Also, we will be launching a one-question survey, just one question, at the end of the webinar, and we would greatly appreciate it if you could respond. We are planning to leave time at the end for some questions, so please ask your questions in the chat box, and we will try to get to as many of them as we can. So now let's jump into this discussion. So we want to start by understanding the root causes of why these stigmas around mental health exist in the Black communities. And we're going to start with Dr. Okoya for this part. Dr. Okoya?
Hi, everyone. Good afternoon or morning, depending on where you are. I see there are a couple different time zones joining us. The answer on why these stigma exist, and I'm glad you asked about the root causes. I think we often talk about lack in communities, but I think what often doesn't get discussed is the culture and the historical context that Black folks have experienced with regard to clinical institutions, with regard to how they were pushed to kind of survive. And the history of anti-Blackness in this country and slavery has created a culture such that Black folks are expected to push through, and that if someone's struggling, they should just be resilient. And oftentimes, and I think Black resilience is an important thing to celebrate, but it's led to this kind of phenomenon where it's normal to operate in a certain way. So I think that the stigma is really rooted in the culture of overcoming and pushing through, which I think is an important thing to celebrate, but it's also made it so that folks can't admit when they're okay, when they're not okay, that there's a lot of stigma related to not being okay, or that we have to pretend that we're okay or put on faces. And as a country, we haven't gotten to a point where thriving is normal or is something that we should be working towards, right? So oftentimes when we talk about Black students or Black communities, we're talking about being free of health conditions, not thriving, not living really, really full lives. So I just think the stigma is really driven by that culture of resilience, pushing through, continuing to drive. And then as a result, we don't have culturally competent or culturally responsive services in communities that meet the needs of Black families and their young people.
Thank you. Granville, what would you add to that?
Can't hear you.
Honestly, I think that she said everything exactly where it is. I would add in there in regards to the culture is just as we got to a place of having mental health services, psychiatry, psychology, we have to just also understand that it really wasn't made for us, for people of color. It was a system that was created specifically focusing more so on wealthy white men. So it really wasn't even made for women specifically. So I think as we matriculated through the years and through our decades, we started to see and incorporate more things, which of course leads to a slower rollout for people of color. So there's that trust factor and understanding that the health system also, excuse me, developed a non-trusting kind of sense. So it's a lot of things that is always intertwined into what our culture was coming up that I think is definitely what Dr. Okoya said is a huge area for the stigma started.
I also want to ask, so oftentimes, so African Americans, the Black community are the most religious of any racial group in the United States. So talk to me a little bit how that plays into this. Dr. Okoya, do you want to comment on that?
Sure, and I'd love for you to chime in, Granville, because I know you have some thoughts around this as well. I think that a lot of times what we've heard is that religiosity is a great tool and spirituality is a great tool for resilience, right? However, when folks are experiencing suicidal ideation or having like extreme mental health issues that they can't pray away, what happens is their community continues to reinforce those thoughts or those feelings as normal, or they need to do more in order to experience something better, right? That maybe you're not doing something well in your life, and that just further perpetuates the harm. And something that I've seen work really well in Black communities is actually having mental health institutions or mental health experts partner with churches. And that works really well because then we can train pastors who are often seen as trusted figures in the community and that people often go to when they're needing help and support. And we've done this in New York. We've seen this work really well in New York City. We can train pastors and even rabbis and other types of religious leaders to understand when they need to refer for other care. So really that kind of culture of pushing through, sometimes if not done well, I think religiosity can kind of be like can kind of reinforce just kind of overcoming, pushing through, praying more, doing more, rather than having folks understand that, you can rely on other systems, you can rely on other people in order to get through this. It's okay not to be okay.
Definitely. I think also in that we have to work with the dialogue that we're having in regards to religion and therapy. I don't think that they are complete opposites or single entities within themselves. I think they actually do work in tandem because understanding where you are grounded at in your foundation, be it spiritual or otherwise, that is a huge aspect of our therapeutic relationship that we create as clinicians, and it's necessary to honor and respect that religious or spiritual connection that grounds you as a person while we are interweaving the therapeutic aspects. So I do think that a huge part of that is just having that dialogue so that based on, as we said before, the culture, if the culture was saying that you need to pray it away and you're not praying hard enough, then we have to then start that dialogue to say, well, maybe this is the answer to your prayers. Maybe it's connecting with someone that is in a position of understanding and learning and an expert in mental health to help with that journey. It's not somebody trying to fix you. It's just somebody that's assisting you in that journey.
I love that example, Grenville, because it's really about meeting people where they are. I've seen sometimes And not to use a counterexample, because there are tons of positive examples of doing this well that I've seen in my work. But a counterexample is, oftentimes I've seen folks judge people for being religious, or judge Black folks for being religious. Well, they're just kind of rolling our eyes at their culture, and understanding and respecting that those beliefs are what helps people to both overcome, and also right now just seem like to be holding them back from seeking other support, but really respecting that this is part of their lineage, that this is what's gotten to them to this point, that it's something that that they lean on is really important as well, rather than ignoring it. Because when we ignore that's someone's kind of frame of reference, we push them away, and the door is closed to having a conversation.
Right. So all really, the root causes around sort of the distrust, the lack of culturally competent care, the prevalence of religiosity, sort of the survivalist mode, all of these contributing factors. So now that we've talked a little bit about that, where do we even start? How can educators start to break down this stigma? How can we create real interventions in our school environments so that we're building a climate in which Black youth in our schools can get the mental health support they need? How do we start to set the stage for that to happen? Dr. Okoya, do you want to start us off?
Sure. Thank you for this question, because I feel so strongly that schools are where this needs to be happening, because our students have to be there legally until they're 16 years old. They're spending so much of their time there. And I alluded a little bit before to meeting people where they are. But what does it really mean to meet people where they are? In public health is kind of the approach that I come to this with, is that we need to understand whether or not people even see this as a problem, right? So if we're using what we call the stages of change model, people have to be kind of in like pre-contemplation mode before they can even begin to take action. And then they contemplate, and then they take action, and then they maintain, and then they might relapse. But if people aren't even in a space where they see mental health as an issue or a challenge in schools or families, like Black families in particular, where there might not be a culture of talking about this or even talking about one's feelings, you have to meet people where they are. So I would say that in terms of the support that when I've partnered with schools and done technical assistance, including my work at the J.E.D. Foundation, some of the work that I do now with Healing Schools, is tiering our approaches. So there should be some interventions that all students are exposed to language around mental health, language around asking for help. So the things that we know promote positive mental health outcomes and prevent suicide, one of the biggest ones is the ability to asking for help. And so if we can create a culture where young people are constantly exposed to the fact that it's normal here to ask for help and say we're not okay, and that every student's exposed to that, then we can push everyone at least into kind of that contemplation phase of asking for help or seeking support. And then training young people around what it looks like when somebody asks you for help. One of the things, the stats that when I was at J.E.D. used a lot was that 78% of young people who have attempted suicide asked a friend before they tried anything, but their friends oftentimes don't know what to do. So we can create a culture of asking for help and train young people when their friends ask for help, what to say, what to do, how to refer. Then we can actually create a culture where it's just normal. We're not even using the word mental health, make people less isolated, kind of closing, we call this vacuum of isolation, and helping teachers, helping families learn to have those conversations. So and teachers modeling to young people, I'm not okay today. How was your weekend? I kind of had a rough weekend. I'm working through something today, but I'm proud of myself for being here. That goes such a long way in building culture, just being honest about the fact that we're not all showing up as the best version of myself is this today. And yesterday it looked a little different, but today this is what it looks like, and being honest about that. If you're dysregulated, you know what, I need a moment to kind of reset myself. Regulated adults can regulate young people. And so if we don't have space for ourselves as the adults who are working with kids, we can't help them build that culture. So I really, I'm not a clinician, and so I want Granville to kind of speak on this. And I believe in clinical interventions in schools. I've partnered with a lot of folks who do clinical work, but I think there are so many non-clinical interventions that we're actually not utilizing that are culture responsive, that just change culture, shift culture, and kind of normalize asking for help, giving support. And speaking about our feelings when we're not doing well and what it is that we need.
I completely agree with that. I think that one of the things that we have to do is start a true discussion and allow for that discussion. As Dr. Okoya said, kind of modeling, allowing adults to model the behavior that we are expecting them to do. I feel like sometimes we have a huge expectation without understanding whether or not there has been instruction behind that expectation. And so when we're looking at emotional regulation, we have to give them examples of what that looks like. We can't peer into their homes to see if that is actually something that their families are given, but giving them an opportunity just to know that when things change, it's okay. If I'm not having a good day, it's okay. It's not just you. Mr. Freeman also has a really hard day from time to time, and letting them see what does it look like for you to manage that. And so if you have a school system that is able and mentally capable of taking on more things, one of the opportunities would be having those trainings. So for Metro RESA, I'm also a restorative practice trainer. So understanding what restorative practices does and having those restorative circles to engage in those conversations is great. And even if it's not a complete training in restorative practices, it's, let's say an elementary school is doing morning meetings. It's an opportunity to have that conversation about, hey, what happens when we are having a bad day? What should we do? Oh, take 3 deep breaths. Okay, let's practice those 3 deep breaths. Because what you then do is you change the culture in your classroom, but then you also include the other students in assisting their peers. Kind of going back again to what Dr. Okoya said, as these younger children are growing up, then they will have the ability to understand, hey, I need to bring an adult into this conversation when a friend comes to me with suicidal ideations, because they know how to communicate and regulate their feelings. Another aspect or training, again, only if that is something that you're able to kind of do, is youth mental health first aid. Giving the adults an opportunity and the vocabulary of what to do in a situation to where they feel that a student is in a crisis or could become in a crisis. I think these are both great trainings, and I'm also a trainer for that one as well. But I think the bottom line and kind of at the root of what Dr. Okoya said, it's really to have those conversations. It's having those conversations, being able to model it. And one of the other aspects of Metro RESA is doing community schools. And so without kind of going into the complete part of what a community school is, it's really about doing intentional partnerships within your community. And so those partnerships can be those that are supporting education, because I know we're talking about having mental health in schools, but I want to make sure that we are also letting schools know we are not expecting you to figure out how to perform mental health strategies or having one-on-one, mental health therapy sessions. We're saying that the school atmosphere is literally a petri dish of a representation of your community. And if your children are hurting, that means the adults in their lives are hurting. Giving them an opportunity to have the partners come in and give them those resources helps with making access more available.
That's, both of you, excellent. Just such a good discussion. I want to ask, there's a couple questions that came through on the chat that I think, I want to throw out there. One, Granville, I think I'll direct to you. What are core mental health interventions that are particularly relevant for students of color, for Black students?
I would say those interventions that are particularly relevant. Number one is giving them permission to have changes in feelings and emotions, giving them permission to give themselves permission to not be okay, giving them permission to reframe that if there is a change in behaviors, that it may not be just a behavior. And I think that, a lot of school systems, we have a dysregulation of like conduct reports, for children of color. And a lot of it is unfortunately rooted in, our systems. And in that systems, you just seem as the angry Black woman or the angry Black man. And that goes back all the way down to the angry Black boy and the angry Black girl. And I think if we are able to see that sometimes emotions, if you aren't in a place of understanding your regulation, anger is not a primary emotion. Anger is an umbrella emotion. It's normally there to hide from the other things that you're dealing with. So giving them those things, and providing them with just strategies to de-escalate. So whether that's breathing or having fidget things, I completely ask for classrooms to develop, if you have the room, a calming corner, and be intentional about the things that you're putting in that calming corner. Give them strategies to work on, and Metro Research should have on their website, different things that could be in your calming corner, depending on whether you're in, elementary, middle, or high school. But your calming corner doesn't have to be completely, decked out, but it could be literally a Tupperware thing that has a iPad that gives them an opportunity to have guided breathing. It could have a coloring book that gives them an opportunity to start to do something else to reoccupy or reestablish what their escalation mode is. And then just make accessible, mental health. Even if mental health is through telemental health, I think that we, as as a community member of the Black community, I think that because of our history and because of our culture and the stigma that's associated with mental health, I do think, and this is coming from someone that was against telemental health, before the pandemic, even though I have a certification in it. I think that it gives them an ability to kind of put its toe in the water, because they get to participate in a therapeutic relationship in the comfort of their own home or the comfort of their own space, without it feeling like a doctor's office. I'm going in to be diagnosed and I have to take medication. And that's not necessarily the case. It's just giving you another member to walk the journey with you. So I hope that answers the question in terms of some strategies or interventions.
Absolutely. And it sort of segues us into our next question, which is around, once we've created these interventions that have, helped to remove barriers, these social constructs that we know exist, that have created this stigma, we're creating a foundation upon which we can build access to culturally and linguistically competent mental health care. But what does the quality mental health care look like for Black families? And you were just talking about it, Granville, around the teletherapy, how to make it accessible, with entry points. So can you expand on that a little bit more?
Definitely. And I think this goes back to the very beginning of what we were talking about in terms of schools being the right place. Dr. Okoya said, if you really think about it, children spend majority of their young lives in the school building. They are legally mandated until they're 16 to be in a building. And they're probably in a building interacting with that community more than they are oftentimes with their own families. So having it accessible and having services like Daybreak coming in to partner with school systems, it gives them not only an opportunity to have a variety of clinicians, but it also gives them an opportunity to have and work with a clinician that looks like them. And I'll be honest, that's probably one of the biggest reasons why I became a clinician, is to provide that to younger people that look like me, to say that this isn't an issue of me judging you. This is me saying, hey, where are we today? And how do we move forward today? And so I think having those opportunities and having it accessible gives them not only the opportunity to do it in the schools, if that is something the school system is able to do, but it also gives them the opportunity to do it at home through those same services being accessible in the school. So it doesn't have to take away from instructional learning, but at least we know it's accessible and that the families and the students have that at their fingertips, rather than trying to figure out, as gas prices are going up, how to get to and from, as food is getting, more expensive. It's not an added expense. And I think that that's where we really get to making it more accessible and decreasing that stigma.
That is, those are all excellent points. And, I would ask Dr. Okoya, when we were having our prep phone call, you mentioned sort of MTSS and how that plays into this whole idea around creating quality mental health care that is accessible for Black families, and what that looks like at the school level. Can you talk a little bit about that?
Yeah. So I think that oftentimes when we think about culture responsive mental health supports, we're thinking about, and I believe that it is important, we're thinking about representation, right? So, connecting Black students to Black clinicians, and that is important, but we're not thinking about all the levels of mental health support that we could provide. And I would say the two most important metrics in a school environment are connectedness and belonging. So when it comes to Black students in particular, but all students, it's really important that young people feel like they belong in the school, not despite their identity, but because of their identity, that we see you, we accept you, and we want you here, that you belong. And so, another metric that we often look at schools is chronic absenteeism. If people don't feel like they belong, why are they going to come to school? And then connectedness, how connected do they feel to the school environment? So I love MTSS. I'm sure a lot of folks on the call use some version of MTSS or RTI where you're tiering students into groups. And one of the things I would recommend doing is tiering students based on this strength-based outcome versus a deficit-based outcome. So when I say that, I mean, oftentimes we tier students based on deficit-based outcomes like chronic absenteeism. So we are tiering students based on how poor their attendance is. If we look at connectedness and we're tiering based on a positive outcome that we want to see, then we're going to create a culture that is more strength-based, if that makes sense. So one example that I've seen work really well in a school that I worked with in the past is they took index cards and put every student's name on an index card, and they took bingo markers, kind of dating myself when I say bingo markers, but like stickers, and marked every student with whom adults in the building had a connection with. And every young person who didn't have 1 or 2 dots, they took those and made those their tier 1 students. And those are the young people who we needed to make connections with. And oftentimes, particularly in a white school, those are going to be the Black students or the other students of color. And I would say that these kind of metrics of disproportionality, we can look at things like disciplinary data. We could look at things like attendance. You're going to see that in a school that's predominantly white, Black students and students of color tend to be the highest with regard to those metrics. So if we can look at, if we overlay that with connectedness, we would see the trend moving in another direction. So using connectedness and using belonging, their perceived belonging to tier students, I think is a really good approach, and really kind of flips the narrative on its head around what are we doing to ensure that students feel like they're connecting and like they belong in our school versus our kids coming to school or not. Because that is the manifestation of the problem. That's not the problem in and of itself. So we really need to be addressing the root causes. And the fact of the matter is that schools were not designed for Black students to be successful. And so if schools were not designed for them to feel like they belong, we have to really intentionally create space where their identities are accepted and their intersectional identities are accepted. And so those tier 3 students are going to be the ones that we push into external interventions that we may or may not be able to provide inside the school. But in reality, for all of our students, for our tier 1 students, for our tier 2 students, and our tier 3 students, we're making sure that they're connected and that they feel like they belong in school and their identity matters.
And actually, Dr. Okoya, to quote you, back to you, connection is the most important intervention to have in place in schools. And it's a non-clinical intervention, right? Mm-hmm. So understanding at a very basic level how we create those connections, those relationships between staff and students. And to go one step further, Dr. Okoya, what you were saying around connectedness and around intentionality, and talk to us a little bit about, centering the Black experience mm-hmm. in this work to create an outcome that we know is so opposite of what educational institutions were first built upon.
Mm-hmm. Yeah. So I love to use analogy, and I haven't made it up. It's the curb cut approach, which my special educators are probably familiar with this. I love special educators. They're amazing, and I think generally use the approach where you're designing for people that have the least access. And in our schools in a country that's kind of rooted in anti-Blackness and anti-Indigenous laws and traditions, our schools reflect that. As Granville said, like our communities and our schools are reflections of one another. So the curb cut approach says that if we design spaces for people who have the least access, we actually could create better interventions for everyone. So an example of that is a sidewalk. So a pedestrian ramp was designed for someone in a wheelchair in mind. When the very name sidewalk says that someone who is unable to walk shouldn't be able to access a sidewalk, but yet we've designed sidewalks for people in wheelchairs. And as a result, we have better sidewalks for people dismounting from their bike, who are pushing a stroller, are in a wheelchair, are temporarily on crutches. We have better sidewalks simply because we've designed sidewalks for people who were never supposed to use them in the first place. And so if we could do that with schools, if we could design schools for the young people who were never supposed to access them in the first place, that we would actually create better school systems for every young person. So if we center Black students in school design, we're going to create better schools for white students, for Latinx students, et cetera, et cetera, et cetera. And so that's just a core belief in the work that I do. And that I think all of this is about design. If we can be really intentional about how we design schools and reimagine what we want education to look like, we can make a lot of change happen.
Thank you for that. And also, Granville, to go back to something you said, which Dr. Okoya just made me think about, which is the school is the microcosm. It's a microcosm of our society. And, you know, looking really at understanding, meeting the basic needs of our students and creating accessibility. You talked in our prep discussion a little bit about Maslow's hierarchy of needs. And then also, you've talked today a little bit about creating strategic partnerships and partnerships that supplement, that do not supplant, but they supplement what is already existing. So can you talk a little bit more about that?
Yeah. So in Metro Risa, one of my other tasks that I do part-time is kind of coaching schools and school districts in creating community schools. And so in the process of creating a community school, you have two routes you can take. You can do the community school route, which is a lot of work at the very beginning, but the outcomes later on, once the work is done, is tremendous. Or it can be just kind of fine-tuning and isolating a one-stop shop where all of your wraparound services or partnerships are going to one person or one location, and that would be more of a wraparound center. And so both aspects focus strategically on partnerships. How are you developing the partnerships? And understanding that there are 3 tiers of partnerships. One partnership is the actual partnership. We always hear partners in ed. Well, we want you to throw that away. And we want you to reevaluate what partnerships are, because we, on the community school side, look at core partners. Those are the people that have a intrinsic desire to be a true part of creating or helping the school meet their goals, whether it's a financial partnership, whether it's them being actively in the school building. Then you have providers that are partners that provide services. So whether it's you having a mental health provider that's coming in and doing things, excuse me, or you have donors, those that donate money, donate clothes, donate food, whatever. And so in the community school sector, we actually kind of going back to what Dr. Okoya said, we actually create and expect you to create those conversations to identify what the problem is and how other people view the problem. As adults, and especially in the school system, we kind of go into this cycle of, okay, well, this is what they need. We need to do this. This is how we have to get it done. They have to do it this way. And so part of that process, if you are choosing to become a community school, we require you to have data from 75% of your stakeholders. So that's actually 75% of students, 75% of teachers, 75% of families, and 75% of the community partnerships. Now that was a little easier, but as you know, the older you get in school, it tends to be the less parental involvement. So when you're doing it with a middle school or a high school, it is so hard to get that 75%. But once you start developing those conversations and engaging the parents and understanding, wow, this is what's going on and this is what I'm seeing, but we didn't know you were seeing it, you then start seeing where the themes are. You start developing what is actually needed in your school based on the conversations that start to overlap with parents, adults, children, staff, and community. And then you can be strategic in what partnerships you're going after, rather than you just saying, oh, we already have all these partners. Be real strategic and intentional into whether or not the partnerships you have are actually the partnerships you need. And so if anybody's looking for information, then you can look at the Netter Center for Community Partnerships out of Pennsylvania, and or IEL, the Institute for Educational Leadership. They also have a community school component that you can do some research on, or call Metro Risa if you're in Georgia.
So related to that, we're talking about schools building strategic partnerships, sort of, how schools are, prioritizing that work. And, also just to sort of frame this conversation, the last thing I want to sort of squeeze in before we do some of the questions is, So we're saying schools are the place to make this happen.
Mhm.
We also know that most of our districts nationally are experiencing severe budget limitations. Mental health needs are up against many competing factors: chronic absenteeism, which we know is directly related to mental health, decline in standardized test scores, we also know is related, and others, right? But we know that, right? And I think schools know that as well, but it seems like the investment in mental health isn't happening, as a priority all the time in a lot of districts. And Dr. Okoya, you've referred to the investment in mental health as an upstream investment. That this is why this investment is important. Can you say a little bit more about that before we turn to questions?
Yeah, so in public health, we use this analogy called upstream intervention. So this comes from an allegory where there were babies in the backwater. So I mean, babies in the river. So there was a river, and all the way downstream, they kept seeing babies, and they had to keep pulling the babies out of the river. There was someone there all day pulling babies out of the river to save these babies' lives. And then someone said, let's go further upstream and ask, why are there babies in the river? And then went further upstream and saw where the babies were coming from. And then no one downstream had to do any of that work, and they saved more babies. So I think that with regard to mental health, in schools, we need to approach this in an upstream manner. What is the environment that is creating these? And so kind of more downstream is chronic absenteeism, is our poor test scores, our behavioral issues in the classroom, right? Upstream from that are the trauma that young people are experiencing, the fact that they don't feel like they belong in school, that they don't have access for people that care about them and that understand them to talk to. And if we invested in that, we actually wouldn't spend as much time catching babies downstream in the river. So I think it feels like such a big investment to put more clinicians in schools, or to partner with organizations that have clinicians, or to invest in teacher well-being so that teachers can show up and do the work that they need to do with young people, and to support them and to model care for themselves and for their community. But we're actually saving so much more in the end. Another thing we hear is like, not that it's so costly, but also that it takes so much time. But it actually is an investment. And if we're having to put out fewer fires, we're going to actually gain a lot more time in the classroom, in our hallways, and we'll be able to have like calmer environments where young people can learn, where families feel comfortable coming. So it feels kind of in this moment of urgency, and where the context, it feels so charged, that it's not important, or that we kind of have to solve the problem that's rising to the surface, which are chronic absenteeism, poor test scores, et cetera, we actually have to look further upstream and see. And I think if we all look up there, we'll see that mental health is one of the biggest issues that we need to address.
Absolutely. Thank you for that. I want to now start answering some questions. The first one is, I live in a predominantly white area, and there's very few in numbers Black folks in general, and understandably insular. However, in percentages, we are very concerned about our Black youth. I think lack of social and cultural space supports in such white spaces is a factor as well, and a range of trust because of multiracial connections. So some of these suggestions wouldn't work here, and we're doing the others already, but I appreciate y'all reinforcing that it's good ideas here. There isn't a Black church, so as to say, or enough Black employees, mental health support for them to feel trust in accessing services. In terms of cultural factor, there's Black Lives Matter signs in intersectional safe spaces such as BIPOC, queer space, etc. And anti-Blackness is discussed in all our meetings, assessment rubrics, etc. But it all feels performative as our Black youth and families are struggling. So what would you all suggest here? It's a big one. Who wants to take that one?
I can start, and I'm sure Granville has ideas too. I would say ask them. I think that a lot of times I'll just say this in a very real way. Oftentimes when I'm working with predominantly white districts, it's a bunch of white people in a room talking about what they should do for Black students and families. Just ask them. They have the solutions that they need for their communities, and they understand what their communities need. So ask them, have conversations with them, and create real space for their voices to be heard, because in reality, these institutions were not designed for them. Oftentimes, Black families have had negative experiences with schools themselves. And like we started in this conversation around like kind of these roots of stigma, they exist. So in order to break them down, we've got to open dialogue with people rather than creating solutions for people. Creating solutions with them, I think, is really, really important.
Yeah, I think you should just drop the mic with that one because you're right. I think it's really creating solutions with people. And going back again to the community schools, that's what we do. We don't just do surveys because surveys tend to be the adults that put them together to have parents and everybody fill them out. We start with interviews. We interview a nice population of all of the stakeholders. We then get focus groups. So having those focus groups of students, and we get real specific. So if you have those students that have a high absenteeism, when they're there, get them in a group and just talk to them about what's going on. What do they see in their school? What will keep them in school more often? And seeing how we can utilize that. My only addition to what Dr. Okoya would say is when and if you have that conversation, make sure you follow up and do whatever is said. Because that conversation has a tendency that if gone performative again, it'll make things worse. And it'll be harder to get back into developing those relationships that are needed for change.
100%. All talk, no action is not it's not good. One more question I have here. What would you recommend to get inactive parents to buy into their students' education and mental health?
Well, I think it's again one of those conversations, and maybe that's one of the key takeaways from this is really reevaluating how we communicate. We tend to have, especially in schools, we have this authoritative kind of hierarchy that we're done. You're the kids, you must listen to whatever I say, and there is no back talk, there is no questioning, you just do. And I think to have parents, because you do have parents, specifically those parents that have had bad relationships with the school system, that could be very generational, that they are automatically thinking that you're trying to label their child. So for me, when I did work in the school system, it was just having real conversations. So if it was a situation to where we had to talk about mental health, it was less of, hey, I think your child may have some issues that they need to talk to a therapist about. And it was more about, I had a couple of students before that had some of the same behaviors that we're looking at right now. And I don't think that they're anything in terms of, problematic, but it was just them having an opportunity to talk to somebody. Did you want to get one of the referrals that they had and maybe call them or let them know that, use the pandemic? Hey, ever since the pandemic, we've seen a lot of students that really, not that they were diagnosed or needed a diagnosis, but just needed an opportunity that wasn't their families to just figure out how does this world work for me. And I say the biggest thing is having opportunities for parents and other adults to know that there's no wrong door to receive help, and it's not about you. So if you are that person that feels like, well, I have a great relationship with Granville, he should have came to me. It's not about you. Maybe that great relationship was because he thinks so highly of you that he felt like if he shared this, he would bring himself down in your eyes. Either way, it's not about you. So yeah, so I would just say continue to have that conversation and just watch how you're delivering it, because sometimes you're working against a lot more than just the child's academics and possibly needing mental health services.
Yeah, that's really solid in terms of like, how you're speaking to people. And I think that some of that's cultural too, is that, people like how respect is defined in the Black community is very clear. There is a clear code of conduct. And so understanding what is seen as respect and what's seen as an invitation is really important. One of the things that I've found in my research is that oftentimes in schools, there's something that folks had called invited partnership, right? That we're doing parent engagement but we're telling people when they're welcome. So people aren't really welcome in the school. There's an open door, but when I open it, and I want your opinion, but only in like as an answer to this binary question, yes or no, right? And I only want your perspective to reinforce what I already want to do. And so if we can actually create space for open dialogue and community building in schools, I think that that's really important. Something that I've seen a lot in schools that predominantly serve Black and Brown students and families, which is different from schools that serve predominantly white families, is that all of the parent programming in a lot of Black schools are parent workshops, which are very deficit based. Their parent workshops are cool, but it's like let me teach you how to parent. And if folks think that they already know how to parent, they're not going to come out to that. And that's the only way for schools to engage, for parents to engage, is by having information put on them. That does not invite true partnership in a way that's reciprocal. So, but in schools that serve mostly white students, you have more robust PTA meetings where parents are making decisions. They've got a budget behind them. They're having like real impact on shaping the way the school is and the decisions that are made in the school. And so I think that it's really important to engage families in shaping the school environment, the school community, through having like coffee chats, inviting families in for breakfast, right? Like, and not just during one time of the day, because a lot of times those workshops would be like during work hours. Late at night, offer virtual kind of ways for families to gather. And there's a question in the chat that's really similar due to stigmas. How can schools get parents of color into the school buildings? I would say, ask them what would bring them into the building. My answer is always ask people what they want and what they need. I think it kind of seems really simple, but it is just that simple. Ask people what they need, designed with the community that you're trying to serve. And I would say both. If it's best to bring people into the school or go out into the community, do both. Because for some people, the school building is an institution they're not comfortable with, and nothing is going to bring them to the school. And for others, there are things that you can do to bring them in. So I would say do both.
Yeah, I mean, I think that's so important. And just to piggyback on that from my experience in Boston Public Schools, and this goes back to something we talked about in the beginning of this conversation. It's all about creating relationships and a climate in which relationships can happen, authentic ones, and where they can thrive. And that's relationships with parents too. And creating access points for parents that are outside of the norm. Like you said, Dr. Okoya, going into the community, but also having open house at a time that works for parents. And sometimes it's really hard for parents to get to the school. So having, a chance for teachers to meet parents at community centers that might be in a neighborhood where parents are coming from that's not as close to the school. You have to create access beyond just saying, here's the school, come up here, meet us where we are. We have to really show parents and the community that we are, as educators, part of their community as well. And that means going into the community, not just packing up at the end of the day and going home. And it's not lost on me that we ask our teachers and our staff to do so much. So how can we create conditions where this doesn't feel like another ask? And I think when we create the relationships and the climate, then when we have these conversations about mental health needs or the needs of students, it's more, you've created an opportunity to have a dialogue and less of a, I'm going to call you and tell you what's wrong with your kid. So I think that's important. But I just want to give an opportunity for any last questions. There's one in the chat about, I've always encouraged families to seek help for mental and emotional health challenges. So I was disappointed recently to learn that Some or All life insurance company considers a diagnosis of depression or anxiety to be a medical condition that significantly raises premiums. Are there other real economic or social consequences that prevent families from seeking help, particularly Black families? And what can we do about this?
Okay. Well, first, I think whoever wrote that, I need to do some research because I did not know that was the case. It doesn't shock me, but I did not know that was the case. What I would say is, honestly, a lot of what we talked about earlier on in terms of just interventions and having different groups and finding out what organizations are doing, self-esteem building type activities or getting your child involved. I think Dr. Okoya said it best: connectivity, and allowing students to connect with other students, allowing adults to connect with other adults is huge with the bottom line of your mental wellness. And so I think that if you're having an issue with, again, this is an economic issue, based on the question that was asked, you can see how different things continue to tie into one another. But if there is an issue with connecting them and utilizing mental health services, find some additional supports that are going on with mental health providers. There was an agency, Dr. Okoya was talking about parenting workshops. There was an agency that I partnered with when I was in the school district, running their hub. They ended up doing parent resiliency meetings. And how they did that was they allowed parents to come in and just say, hey, how are you doing? And then as they started getting more comfortable and talking about, well, this is what I've been dealing with, this is what I've been dealing with, you can kind of weave in parenting tips while having a conversation. So it's not, hey, you need this because this is not working for you. It's more having a conversation, developing community within other parents and seeing that I'm not alone. That universality of, I feel like the things I'm dealing with is only me, changes a lot. So those would be the things I would say, is just kind of utilizing your partnerships outside of mental health, or finding out what other services, groups, opportunities mental health providers are doing to reinforce mental health work without it actually being a session that needs a diagnosis.
Are there any last thoughts either one of you want to add before I close this out?
I want to just punctuate the point that I made in the chat to Casey, but I don't want to rush past Granville's amazing answer to that question. So I think, Casey bravely asked your best advice for white staff in trying to create connection and belonging with students of color, what matters the most. And I typed in a brief answer to that, but I would say humility, authenticity, like be yourself. Don't try to be down, or, like don't try to change who you are or do research on like, what Black students like. Just show up as yourself, but also make sure you're showing interest in what they do, what they care about, and make sure they feel like they belong in your classroom, and just bring a lot of humility to that. I think it's just really important to do that. I will also say a really important thing to do is maintain high expectations. One really pervasive form of covert racism is low expectations for Black students and Black families. And so if we lower the bar for them, we're saying that they are less than. And so I think it's really important, and this is something that's come out of healing-centered research and trauma-informed research, is that high expectations and high accountability with support are really important in making sure that people feel safe, supported in their community. So show up as yourself, be authentic, but also keep the expectations high. I think that's really, really important.
Both of you, Dr. Okoya and Granville, thank you so much. I actually cannot thank you enough for allowing us into both of your spaces and really sharing your deep knowledge and expertise with us. This was such a gift for me, and I know it was for all of the attendees. You both are doing such amazing work in our communities, with our young people, with our families, with our staff. And, I want to say thank you from, I'm sure, everybody who is tuned in right now, and from Daybreak Health. This truly, truly was an honor to be in this space with you. So thank you. And before you all go, if you want to learn more about Daybreak Health and how we partner with districts to provide culturally and linguistically competent school-based mental health, like teletherapy and on-site services for students and families, please respond to the survey that is going to pop up. We'd love to connect with you. And please connect to Dr. Okoya and Granville on LinkedIn, see all the amazing things that they're doing, because that is just it. They are doing amazing things. So thank you to both of you, and thank you to everybody who attended today. And I hope everybody has a wonderful rest of their day.